Now we're looking at the next artery in the lower limb, which we are getting to look at its anatomy, and this is what is known as the posterior tibial artery. So for the anatomy of the posterior tibial artery, we have it like this. This is what the posterior tibial artery. So the posterior tibial artery is one of the two terminal branches of the popliteal artery, posterior tibial artery, and the fibular artery. Okay, so it runs down the back side of the foot, back side of the leg. So that is what the posterior compartments. So it arises from the popliteal artery at the lower border of the popliteus muscle. The other terminal branch is the anterior tibial artery. Okay, do not here, So let's move. Cause it descends in the back side of the leg, that's the posterior compartment of the leg. It runs with the posterior tibial veins and the tibial nerve. Okay, and it passes posterior to the medial malleolus within the tarsal tunnel and terminates by dividing into the medial plantar artery and the lateral plantar artery. Okay, so gives branches to the peroneal fibular artery, and also gives branches like the circumflex fibular artery, the nutrient artery of the tibia. Also muscular branches that will now supply muscles around that area, and the medial malleolar branches, the calcaneal branches, and also terminal branches. Right. So distribution is it basically what drains. Okay, arteries supplies, right, the tibia, the ankle joint, and the heel, and the plantar surface of the foot. Okay, so it travels to the tibial nerve and the posterior tibial veins. Okay, so clinical importance is very important because you can take pulse from there. It's important in tarsal tunnel syndrome, and is very important in surgeries too, and also could be affected in diabetic foot.